The World Health Organization only very recently cited a report to talk about the fact that over 144 million people could be affected by long COVID. In fact, there is enough anecdotal evidence over the last almost 3 years and also several data that seems to be suggesting that long after recovery, there are signs and symptoms and problems associated with COVID-19, and that in short is long COVID. Long COVID is a serious medical condition. In December 2021, the World Health Organization had identified long COVID as post-COVID-19 condition comprising a constellation of long-term symptoms that some people experience after they have had COVID-19 and had named the ones suffering from it as long haulers. Now, doctors at Delhi's premiermost All India Institute of Medical Sciences have spoken particularly about 3 kinds of symptoms that are associated with long COVID. This is primarily a brain attack or stroke in arteries. Post-COVID, doctors say there can be development of complications in the brain. There are immediate acute situations like brain attack or stroke in arteries, veins, or brain inflammation. However, doctors have said that research is underway to understand this better.
So we are very clear that COVID, even though mild, may affect people for a longer duration, over up to a year, and create increased incidence of heart attack, strokes. We know that COVID itself, in the acute phases, causes increased incidence of strokes related to clotting, related to inflammation of the arteries, also increased incidence of clots in the brain causing strokes and clots in the lungs. But we are concerned about the long-term effects also.
Doctors say that there has been an increase in brain and heart-related issues during the second wave of the pandemic. In the current scenario, more data is required is what they say. In fact, according to Dr. Ashok Seth, chairman of the Fortis Escorts Heart Institute, a study found says there is an increase of 60% of the incidence of heart-related issues and neurological disorders. The way forward is never to ignore any of the symptoms that have cropped up and also consult a doctor immediately. Long COVID is associated with any kind of COVID infection, even though the infection per se would be mild. There is nothing that's going to really rule long COVID out. This means that COVID, even though mild, may affect people for a longer duration up to a year and create increased incidence of heart attacks and strokes.
For more informative videos like this, keep watching India Today News Mo.